So what has changed over the time is that the options which we have available for the patients who are 65 plus or who are in the category of geriatric patients, we are going from an area where we had only the open options like surgical interventions, which were very tough for those patient population to bear the burden of the surgical procedure. Now we are moving towards the minimally invasive procedures where you make an incision less than centimeter size and are able to help those patients. So that's where we are changing, and I think we can help those patients in the future, because one of the problem was because of their age and comorbid conditions, they were not subjected to majorly invasive surgical procedures. Now we have an option to provide, as the medical field is growing, minimally invasive options to help those patient population. So one of the common problem which I see from an interventional pain physician point of view is lumbar spinal stenosis. We see the patients who are 70, 75 plus, they have the symptoms, and the majority of the symptom is that when they walk for about, say, 10 or 15 minutes, they have to sit down to help in their symptoms. Or, and when they go for grocery shopping and they take a cart and bend forward, that helps the symptoms. So in other words, they are unable to walk or stand for longer duration secondary to the back pain. And when you get an MRI, most of the patients have something called as a lumbar spinal stenosis, and that's what the majority of the symptoms which I see in the patients. The second other thing which I see in the patients, in that patient population, is they have arthritis in the back, and they have this back pain all the time and the stiffness in the back. So those are the two common symptoms which we see. There are minimally invasive procedures which has come in last probably like 5 or 7 years, and some of them are minimally invasive indirect lumbar decompression, and some of them are direct, and they all involve about a centimeter size or a 1.5 centimeter size incision. They're outpatient procedures, and the patient goes home the same day, and many of those procedures are done under sedation, so they don't even have to go under general anesthesia for that. Anybody who has a back pain, you want to try something simple or basic first, which is physical therapy, strengthening the core muscles, and then if that's not working, then you have tried some medications like neuropathic medications, anti-inflammatory medications, and if those don't work, then you go for a step up, which is trying injections if that helps, and then the last step is minimally invasive procedures for those patients. So I think the algorithm still remains the same for those patients, but clinical studies have shown that minimally invasive procedures do help and provide them a long-term relief, those patients.